happy holiday to you.
We'll talk about putting a smile on your face, huh? Listening to that holiday music. And if you want a new smile, consider Dentures. Dr. Martin Goebbel of Southern Blvd Dental is here with us to take us through the process. Good morning, Dr. Goebbel.
Good morning.
Happy Thanksgiving week.
Happy Thanksgiving week to you.
It's here already, and a lot of people doing a lot of smiling. So let me ask you first, who should have dentures?
Dentures should be considered to be a last resort.
Okay.
Only for those patients that have lost bone and the support of the teeth, have tremendous cavities. They are not what they're cracked up to be.
They're not. They're better. Is that good or bad?
It's better than nothing.
Okay.
It gives you something to smile with.
Yes.
As far as eating goes, they're not that great.
Well, if you already have dentures, how do you know when to replace them?
Well, dentures become loose over time. As you use dentures, they put pressure on the bone. Pressure on bone causes it to dissolve.
Okay.
Well, if bone dissolves, then the support for the denture, when it was made, changes.
Right, right.
So the denture gets floppy and moves around.
So so a patient would come to you and say, I'm getting a feeling that things just don't feel as stable as they used to?
Exactly.
Okay.
The other thing that happens is your chin gets too close to your nose because the bone dissolves, and then instead of being like this, you overclose.
Well, is replacement the only option?
Well, replacement's the start.
Okay.
Now, we can stabilize the lower denture with what we call mini dental implants.
Yes.
Those implants are very simple to place.
They are?
Yes.
So people shouldn't be too intimidated then?
No.
Well, what's involved with using the mini dentures then?
Well, first
the
of
mini
all,
implants they're called? Mini implants?
Mini implants.
Okay.
First of all, what we want to do is get a 3D CT cone beam x-ray, which will show us the amount of bone that's there.
Okay.
And find the best bone to put these in.
Okay.
Once we have that x-ray, we go ahead and we make what's called a surgical guide.
That sounds scary, but is it?
You take an impression. This is made outside the mouth.
Okay.
And basically it tells us, the dentist, where to put those implants.
So that's where you start. That's the starting point?
That's where we start.
Okay.
Okay.
And then from there, so you know how to place it by doing that x-ray? You can see which bone it fits in the best? That's how it works?
Exactly.
Okay.
And the placement involves anesthetizing. You have to be numb.
Sure.
Okay.
Which is always better anyway, really.
We use this surgical guide to pre-drill a hole, and we don't have to cut the gum.
You don't?
We just go straight through it.
See, that's what I was wondering.
These implants are very, very small. This is an example of them having been placed in a model here.
Okay.
And we usually do, what we usually do on the lower is 4 implants. And again, this is how they're placed.
Okay.
Using the guide. And once they're in, we take the existing denture that has just tissue, and we put attachments in it. And those attachments then snap down onto the implants.
Oh, they snap.
And when they do, you have a stable denture.
Now, is this painful?
Very little discomfort.
Really?
Bone doesn't have much nerve in it. And we're going through the gum in a very, very small area.
Okay.
Very little bleeding.
That's great.
The entire procedure, from once we have the surgical stent, placing the implants and modifying the dentures, getting the attachments, the snaps in, takes about 2 hours.
The whole process, 2 hours?
And you're wearing the denture the same day.
See, that's amazing. So, and it's not something that you have to have downtime, or do you have to have downtime? Not at all. So if you took a 2-hour lunch break that day, you could actually have it done and still be back at work later in the day.
Yep.
That's amazing. See, I think a lot of people, I would think that it would take a long time. It would be a whole day situation.
Well, that's the conventional implants.
Sure.
The larger ones.
But for the minis, that's great.
Do have more downtime. It's a much more invasive procedure.
Right, right.
Both have their application.
Okay.
The minis are used mostly to stabilize dentures. They can be used to replace a single missing tooth, depending on where that tooth is.
Okay, so that's comforting if you don't want your whole mouth.
Right.
Can we see some before and afters? I think that's a great way for people to see the difference and understand really what they can look at. Now, what are we looking at right there?
This is the lower jaw with the tongue hanging in there.
Yeah.
And you can see the bone's fairly flat. There's very little little there for the denture to grab onto.
Right, right.
A lower denture is like a horseshoe in your mouth.
Oh.
And if there's no bone to support it, it flops around, it moves. Every time you move your tongue, it flops.
Okay, so now what happens next?
we place the implants, and these are the implants in place.
Okay.
And this was taken as soon as we finished placing the implants. You can see there's very little bleeding.
I was going to say it's not a lot of redness and there's no bleeding. It almost looks like somebody got like piercings or something.
It's similar to, I mean, going through the skin is similar to a piercing.
Yeah, absolutely. Well, let me ask you this. I mean, realistically, is it expensive?
Minis are about half the cost of the conventionals.
Can insurance cover that if you're having some problems, or?
There's some talk of medical covering it for compromised patients, diabetics that need to eat better.
Okay.
But it's iffy right now.
Okay. Do you find that there's a certain age group? I mean, I know a lot of times we've always associated dentures with senior citizens. Maybe as you get older, your teeth maybe get a little weaker, and you start to think maybe you need to think about dentures. But there are very young people using dentures as well, aren't there?
There are some younger people that, because of medical conditions, that have lost their teeth.
Yeah. And it's nothing to be ashamed of. It's nothing to be ashamed of because we all want a good smile.
Right.
And that's just, I just always feel like you should get that message out, because I think people get intimidated by doing things with their smiles that may be artificial or maybe deemed fake, you know, because they're thinking, well, that's not my real teeth. But you know what? Who cares? As long as they're strong, they're stable, and they look good, who cares?
And the function.
And the function, yeah.
Right.
And these are very functional?
Well, it holds the denture so that it supports the denture so it doesn't push into the tissues when you try to chew.
Yeah.
It keeps the denture from flopping around.
That's good.
So it's an ideal treatment for somebody that has a lower denture.
And also, I like the fact that you said if you have one missing tooth, you know, people have accidents, things happen, you just lose a tooth. To be able to know that you can replace it this way would be great.
Right.
And affordably as well. Let's remind our viewers where Southern Blvd Dental is located so they can find you.
We are at 2716 Southern Boulevard up in Rio Rancho.
And you can always go to the website.
sbdental.com. And phone number is 892-8600.
Dr. Goebbel, thank you so much. And good smiles are definitely something to be thankful for, so we thank you for that.
Happy Thanksgiving.
Happy Thanksgiving to you too. And still ahead on New Mexico Style, we'll tell you all about the holiday entertainment lineup at the Hard Rock Hotel and Casino. Also strategies to wrap up your financial year and some great details about Toys for Tots. Don't go away.